break and then kind of go over what we heard these last 24 hours, if that's okay.
Okay.
Okay?
Good morning.
Morning.
I truly apologize that I'm a little tardy. We had a big event yesterday, and I've been dealing with the end part of that, and it totally slipped my mind. But I greatly appreciate you guys the opportunity for me being here today. My name is Demetrius Collier. I'm the executive director for NAMI Brazos Valley. So I just wanted to take the time to present to you guys the reason that we are requesting the funds and what it will be utilized for. We're deeply grateful for your past support, and today I want to share why your continued support will be beneficial for our organization. Of course, mental illness is a public issue with a public cost. It impacts law enforcement and jail populations, emergency rooms and EMS, local schools, and families. County governments often bear the brunt of untreated mental illness, especially in rural and underserved areas. What we're offering is a cost-effective community-based response that helps individuals before they reach those crisis points. Who do we serve? Of course, NAMI Brazos Valley serves 7 counties, including Brazos County. And those counties include Burleson, Grimes, Leon, Madison, Robertson, and Washington. We provide free education support and advocacy for individuals and families affected by mental illness. Services offered both in-person and virtually, allowing us to reach rural residents with little or no access to care. The funding request will be used to expand culturally responsive programs, including our new Spanish-speaking as well as Korean share and care groups. Support program staff and coordinators will deliver the education and peer support groups. We also partner with MHMR for mental health first aid to provide mental health first aid training to individuals that support like their family members, for youth, for adults, and those that have been diagnosed with a mental condition. The funds will also be utilized to include like storytelling, dialogue for like the different communities where it'll be culturally based. So say for instance, if it's Spanish or if it's Asian, it will be based on those cultures so that they will feel more comfortable with sharing and breaking the stigmas for those cultures to receive assistance for mental health. And then we ensure like access through technology. Again, we already provide like the virtual for those that may not be able to go into a physical location in those rural areas. And so for Brazos County, we are definitely utilizing the virtual because some people don't feel comfortable with leaving their homes. And so to make sure that we're able to provide them with the support that they need, we make sure that we have like computers, Zoom, so that they can actually join in the support group meetings through the internet. So as I was stating before, we're launching it's the first time for Brazos County to be able to have the support groups for each culture. And so we're testing that out already with the Spanish-speaking share and care group. And once we're able to get the person that's over the share and care group trained as a facilitator, then we will launch it so that we can actually have more people utilize the service in that culture. Our work helps the county avoid much higher expenses by reducing more ER visits and 911 calls, preventing incarceration due to untreated mental health conditions, supporting families and schools before situations escalate. For every dollar spent on prevention, counties save $4 to $7 in downstream costs for every dollar. We don't do this work alone. We're proud to, again, partner with MHMR for the mental health first aid trainings. We also are starting to partner with more local health providers to try to get those individuals a discounted rate for those that may not be able to afford, like going to get the actual treatments. So we're making sure that we're creating those partnerships to make sure that everyone at every level has the support that they need. I also get the opportunity to partner with other underserved areas. I know that Grimes County has the Lutheran unit. Even though it's not a part of Brazos Valley, we still get to partner with other people to actually provide mental health support to those that are incarcerated. So that could be something that we can work on here in the Brazos County as well, because what is missed is that a lot of those individuals that are incarcerated have mental conditions which may be temporary because of their incarceration or the reason that they're there. And so we could potentially start a partnership with Brazos County Jail to speak to those individuals, or just provide a presentation on how they're able to support themselves mentally once they are released. Unlike large systems, NAMI is peer-led, grassroots, and trusted by the people we serve. So with that being said, so say for instance, if I have a mental illness and you have a mental illness, I lead you or you lead me. We basically get you trained if that's something that you're interested in, so that people feel comfortable. Not just all, some people don't feel comfortable going to a psychiatrist or a psychologist. Some people feel better when they're with their peer, someone that they can actually trust. So our support groups are peer-led, and so we have to get them those facilitators trained to be able to do those. Most of the people are already in the group, so we just, if they are interested, we get them trained in that regard. Some people do. I receive a lot of phone calls in reference to people feeling more comfortable reaching out to NAMI before they reach out to the police, before they reach out to any other organization to receive help. And so we do need manpower to be able to answer those phone calls, to be able to make sure that everyone receives the resources, because even if NAMI Brazos Valley isn't able to provide that specific resource, we make sure that we have all the available resources in our area so that we can get them over to the appropriate people. We are committed to tracking the results. So basically, we have attendance, participation feedback, mental health literacy, and stigma education and reduction. This funding will help us pilot and sustain these programs long term, supported by volunteers and community partners. The funding, it represents hundreds of families supported, dozens of crises averted, lives saved, and dignity restored, and breaking stigma. NAMI Brazos Valley is already making a difference. With your continued support, we can do even more. Thank you again for allowing me the opportunity to speak. I greatly appreciate it.
Thank you.
Thanks, Commissioner.
Questions?
Do you have any questions? I'm sorry.
No, thank you.
Thank you.
No questions?
No,
No question.
Okay, thank you.
Thank you.
I would like to kind of rehash what we heard these last 24 hours regarding the outside agencies so I can have direction on how to proceed with proposing the budget. Do y'all mind taking a 10-minute break and then us coming back just to kind of review some numbers? That'd be okay?
Okay, so we'll come back in here, yeah, is that? 9:58, so.
10:15?
What about 10:15?
Perfect.
Okay.
Girl, you missed everything.
They were fast this morning.
Yes, ma'am.